Hi everybody, I'm Dr. Rooney. I am here today to present to you Facebook Live topic, the immune system and its effect on chronic disease. So to me personally, this is one of the most important factors to somebody getting sick or somebody being able to heal or prevent disease. So this to me is one of the most important topics. Your immune system or your inability of your immune system to regulate properly is the cause of most chronic disease at the cellular level. So they use the term inflammation, and inflammation is the root cause of most chronic disease. So we want to be able to break that down for you so you can understand what happens to the immune system and then what causes that dysregulation, if you will. So my role at the clinic, I do chiropractic care, I do sports medicine, rehab, but I also look at patients from a different angle. And what I mean by that is I want to look at them from cause and effect. So if they have inflammatory windup, if they have immune dysregulation, if they have gut issues, if they have poor liver, what they call biotransformation, or the ability of the liver to clear out toxins, if they have blood sugar imbalances, if they have hormonal imbalances, thyroid imbalances, etc. My job is also to evaluate each patient for all those things and then be able to work through with help from the other clinicians or in conjunction with the other clinicians to be able to make sure that we address those causes, okay, so their body can heal. And the whole idea is, what can we do as clinicians to make sure that we set your body up and maximize its upside, if you will, and minimize the downside, okay? So the number one thing I'm going to tell you is the immune system and its ability to regulate and its ability to allow you to heal, as opposed to creating massive amounts of inflammation in the body, which will then lead to chronic disease. Okay, hopefully that makes sense. So the first thing I want to go over is the pathways that get affected. Now, this might get a little tedious, but I'll explain it step by step, and then I'll come back around and explain it again so you can understand it well. And this will be on our website, on Center for New Medicine, the Facebook site, so you can go back, watch it several times if need be, okay? So we have the pathways that start to break down here, but then over here we have the causes. So there's cause and then there's effect. So here's the deal. Immune system-wise, we want a fire burning in our body, right? We'll use that analogous to the immune system. But we want a small fire, one that can find disease or find antigens or bacteria or viruses, infections, etc., be able to recognize those and then be able to kill them, basically. We want the immune system to be able to recognize bad cells as well, like a cancer cell, and be able to kill that as well, okay? When the immune system is regulated, that's what happens, okay? When it gets dysregulated, those things don't work really well, okay? So one of the things that happens when we have too much fire going on, all right, we get an increase in something called prostaglandins or inflammatory cytokines in the body. The name for those, one of them is nuclear factor Kb, and the other one is something called COX-2. So we hear a lot of times in the medical world, COX-2 inhibitor. So a COX-2 inhibitor is something that helps knock down these pro-inflammatory cytokines and prostaglandins, okay? So because we have these constant fuels, which I'm going to go over in a second, we get this windup, okay? And those inflammatory proteins and prostaglandins start to increase. What happens next is that we start to lose something called glutathione. So glutathione is the body's most powerful antioxidant and anti-inflammatory in the body. The body makes it. The problem is when we're trying to constantly knock down these inflammatory proteins and cytokines, glutathione starts to run out. We can no longer recycle our own amount because it's working overtime, if that makes sense. So we start to lose our glutathione, okay? So if we're losing our body's most powerful antioxidant and anti-inflammatory, that's going to create havoc on the body, okay? The next thing that may happen, and there's chicken or the egg with these things, so just hang tight and I'll explain that. The barrier systems in your body, because of this inflammatory windup, are going to start to break down. So one of the main barrier systems that we have to be constantly aware of is your gut barrier, okay? There's a term called leaky gut. And leaky gut, I'll explain and so you can really understand this, is a breakdown in what they call the tight junctions in your small intestine. So here's how this works. If I eat a food and I can break that down in my stomach the right way, right? If I have the right enzymes, I have the right hydrochloric acid, I can break glucose down, sugars down to glucose, I can break proteins down into single amino acid form, and then I can basically, they move into the small intestine. In the first third of the small intestine, which is a closed tube, is where absorption takes place, right? And what that means is these glucose molecules, for example, can leak through, okay, or permeate through the wall, get into the bloodstream, into the cell to be used for energy. That's how it's supposed to work. But when I have this inflammatory windup, those tight junctions that are only supposed to let small things through become wider. And now they start letting more and more things through. And they'll let things through like toxins and chemicals and proteins that aren't digested well that come from things like gluten and dairy and soy, cooked products or denatured protein, etc. So when those things that aren't supposed to get through the wall start to get through the wall and get into the bloodstream, your immune system doesn't recognize those structures as self, so it attacks them. The byproduct of that attack is inflammation or an increase in these prostaglandins or cytokines, they call them, pro-inflammatory agents. We'll just use that term. So what may not have started the process now is going on, which now continues to contribute to the process. So leaky gut is a big, big deal. So not only personally do I take patients through this part of the process, I definitely work with their gut. Almost every patient that I ever worked with, I worked with their digestive system. And I'll get a little further into that. If we have leaky gut and we also have possible infections in the gut, like candida, fungal infections, parasitic infections, etc., we're setting ourselves up for constant inflammation. But those infections will also continue to cause leaky gut, okay? So if we're looking at this pragmatically and logically, what we want to do is make sure, and I'll go through this again with you, make sure we're controlling this, but also making sure we're getting rid of the bad foods, leaky gut, and infections in the body, okay? If we can start taking away the fuel to this fire, we're going to be able to heal long term. And I'm going to keep going with that concept, but I'll finish this up and then we'll revisit that, okay? So just remember real quick, fuel to the fire, fire. Outcome, cause, okay? That's a big deal. So let's continue on. Another area of barrier breakdown that happens is what they call the blood-brain barrier. So a person that's getting blood-brain barrier compromise secondary to inflammation is going to have foggy brain, they're going to have memory issues, they're going to have where their head feels heavy, and it's mainly because there are inflammatory products, if you will, that are starting to leak through the blood-brain barrier and creating inflammation in the brain. So when somebody has a concussion, their brain's inflamed. When somebody has this inflammatory windup going on from here down, right, and it's crossing the blood-brain barrier, the effect on the brain is no different than the effect from a concussion. It's inflammation. So the cells become inflamed and we start getting those issues, memory issues, we start to get forgetful, we start to get fatigued and brain fatigued, foggy brain, we don't have as much motivation or energy because now also, not to get too deep into this, our neurotransmitters like dopamine and serotonin that are our feel-good hormones or feel-good neurotransmitters are now become deficient because they're no longer working well because the inflammation is creating a block in the receptors. So we start to get a trickle-down effect when we have this inflammatory process from the blood-brain barrier being compromised as well. So I touched on that. That's a big deal. So we look at the symptoms with a patient, and these symptoms can help direct us down that road as to what we need to look for, what we need to test for. And I'll wrap that up in just a little bit. We also can get lung compromise. So somebody that has asthma, has a constant wheezing, or when they eat certain foods, maybe they get tightness in their chest. If they're outside a lot and they're breathing in these possible harmful chemicals, toxins, what have you, their lungs start to become inflamed. That is another example of a barrier compromise. So real quick, when we lose our barrier compromise, we lose our tolerance to our environment around us. So our blood-brain, gut barrier, and our lung barrier, they're designed to be able to keep us safe and healthy, right? That we don't get overloaded. But when they start to break down because of this inflammatory windup, now we're susceptible to walking into a store and breathing in some type of chemical or fragrance and having a headache and have an immune reaction to it. We could have reactions to foods that we never had before. We could have reactions, again, blood-brain barrier reactions that we never had before. So basically what's happening, we've lost our tolerance. So if our tolerance is way up here, we're about right there, and every little thing from the outside world can affect us. So that's another, I hear that a lot with my patients, that they're dealing with these things, and I just tell them you've basically lost tolerance because you've lost the ability to neutralize some of these outside chemicals, additives, preservatives, foods, etc. that you're seeing every day in our environment. Okay? Hopefully that makes some sense, and I'll touch on it a little more. As this whole windup starts to happen, we're going to get a problem down here with these immune cells. So let me explain. If you see here, it's called Th3, and I'll use a term called T regulatory cells. So the Th3 pathway is synonymous with T regulation. So the T regulatory cell's job is like a traffic cop. It's supposed to direct traffic, right, of these other cells of the immune system. But again, when this stuff is really going on and this windup is happening, these traffic cops here, T regulatory cells, become drunk, and they no longer direct traffic the right way. So it's a little funny additive, right? Like if you picture a traffic cop, they're supposed to be stopping this car, waving this car, letting that one go, stopping this one. Well, that's uniform. That's controlled chaos, right? In the body, this cell does the same thing, but because of this windup, it starts to get drunk. So now you have a drunk traffic cop. Okay, let me explain what that T regulatory function does. Over here we have a T cell, or Th1 pathway, and over here we have a B cell, or we have what they call the Th2 pathway. So here's how this is supposed to work. Say I have an infection in my body, say a virus, okay? The T regulatory, or the traffic cop, is going to tell the T cells to go attack that virus. So it's basically going to release the hounds. Go fight, release the army, and it's going to neutralize this virus, or basically get on top of it long enough so our immune system can eradicate it, basically, right? Once that is neutralized, that virus is neutralized, the regulatory cells, or the traffic cops, are going to call the army off, and it's going to calm down the T cell response, okay? Once that happens, it's going to trigger the B cells, what they call B memory cells, to raise, right? Release that army, and then it's going to tag, the B cells are going to tag the foreign invader for future recognition. That way, if we're exposed to the same virus again, we won't get sick because of there's a memory to it. And that's kind of how the way vaccines are supposed to work, for example. They're supposed to go in, we develop this immune reaction, B cells tag it, and then that way if we're exposed to that, whatever we're vaccinated against, it's supposed to work like that. It really doesn't. But anyway, that's how it's supposed to work, just to give you an idea. All right? So the whole idea is this T regulatory cell is creating homeostasis. Up, then down. Up, then down. And that kind of works almost on a daily basis in your body. If we have a really bad infection, then we get a major amount of T cell response, and as a result, you're going to get inflammation. So when you don't feel well, right, because of a illness, say a flu, you're going to be fatigued, you're going to be sore, you're going to be achy, you're going to have brain fog, you're going to have heavy head, right? No different than what happens when we have these things going on, right? So the symptoms are very similar. The point I'll make is that this T regulatory function is critical to the process of controlling your T cells and the B cells. But what happens is this becomes drunk, and that no longer works well. So what could be the effect? I could have an overabundance of T cells going on in my body constantly. This is going to be somebody that is rarely get sick, meaning they don't get a whole lot of colds and viruses and flus, but they don't feel well daily. And it's because their T cells that are attacking these foreign invaders are high. So because they're high, you're not going to get sick much. They're more abundant than they should be. However, they could start getting dysregulated, meaning they could start attacking things that they shouldn't. So what I'm explaining here is the setup for an autoimmune condition. So if I'm attacking, say, my thyroid, this is exactly what happens. All this happens, my T regulatory cells get dysregulated, and then I get an imbalance between the T cell and B cell response, and I can have as an example, I can have an overactive T cell response. So the T cells are fighting like Pac-Man going on in your body, and they start attacking things that they shouldn't attack. Okay? That's the setup for autoimmunity. You could have too many B cells too. So if I have too many B cells, and there's different things or different effects of the body that will cause that, I can be tagging a bunch of tissues that I shouldn't be tagging. So I'm not only tagging foreign invaders, I start tagging healthy tissue. So that could be a thyroid, it could be your joints in rheumatoid arthritis, it could be Sjogren's, it could be celiac disease in the digestive system. There's endless amount of autoimmune conditions. And what we don't know in science, right, because I've asked this questions, I've studied it, we don't know why a tissue is attacked, say the thyroid versus the joints. We don't know why it'll pick one versus the other. We just know that the mechanism is here, okay? And so if we want to calm down an autoimmune response, as an example, we have to go through this entire process. We have to regulate the T cell function, T regulatory function. We have to possibly balance the T and the B cells short term until we get rid of these fuels that are driving it. And I'll talk about that in a second. So hopefully that helps. In short, we need to sober up the traffic cops. That's the number one thing we need to do. And then we need to go back and we need to do things that'll help pour water on these fires here. And I'm going to explain what kind of supplements help with that. Okay? So we also get, and not to get too technical here, I know I already have, but Th17 pathway is something called your nitric oxide pathways. Okay? So we have two types of nitric oxide, inducible and epithelial. And what happens is this nitric oxide inducible goes way up with this inflammatory response and creates a massive amount of inflammation, okay? The ENOS pathway, which is called your epithelial, is basically subdued. And epithelial nitric oxide is what allows for perfusion, meaning blood flow through the tissues. So if we lose the ability to perfuse, we get less blood flow to our tissues. That's a big deal. So we want to try to regulate that pathway as much as we can, and there's products available to be able to do that as well. So this is definitely not pushing products at all. It's just giving you an idea of how you can subdue this whole response, okay? So I'm going to go over the two things that will knock down the NFK and COX-2 response. Number one is curcumin, and number two is resveratrol. And they work really, really well to do it. With each person, people will ask me, well, how much do I take? Well, as a clinician, I have to decide how much to administer based on how much fire is going on. So if their fire is big, I have to use more water to put it out. So some patients, it might be 500 milligrams a day, it could be 250. For some, it could be 1,000 until we get that response knocked down. It just depends on the individual, and that's what makes it a little bit tricky, right? Resveratrol, same thing. It could be 500 milligrams, could be 250, could be a couple capsules a day, depends on the product, depends on how much you're getting. The point I'll make is resveratrol and curcumin are two great products to be able to knock down this NFKB COX-2 response, okay? Glutathione is another product that's really, really helpful. We need to recycle it, but we also need to help regulate these T regulatory cells. So I'm going to jump over here because the gut is a whole different story. But if I wanted to regulate T regulatory function, the number one thing that needs to be adequate in the body is vitamin D. You have to have it. I would say 98% or more, probably, of all the patients I ever worked with were low on vitamin D. If you're low on vitamin D, you are setting yourself up for chronic disease without question, and the research is overwhelming. So again, how much? Just depends, right? It depends on the kind you're taking. It depends on your fire here. But vitamin D is critical, and making sure you're getting that tested is critical for sobering up your traffic cops. The second thing is glutathione. Remember, it's the body's most powerful antioxidant and powerful anti-inflammatory. So we need that in conjunction with vitamin D to help regulate your immune system better. Phenomenal, phenomenal for that. Another one is omega-3 fatty acids, right? And I would recommend, the research is pretty clear, but omega-3 fatty acids, you need probably around 2,500 to 3,000 milligrams, and somewhere between, say, 1,300 to 1,500 of EPA and DHA. So if we get just those three things, plus some resveratrol and curcumin in our system, what we're going to be able to do is we're going to be able to pour water on this fire, okay, and help regulate this dysregulated pathway that could lead to autoimmune conditions, that could lead to cancers, that could lead to these different chronic diseases. When somebody has this going on, they're going to be fatigued, they're going to not feel well, they could have light joint pain, light flu-like symptoms chronically, okay? That pathway is going to lead to inflammation and copious amounts of it. And depending on, which we're going to talk about in a second, how many fuels are causing this pathway to go nuts, is how much inflammation a person is going to have or immune dysregulation, okay? So in INOS, there's a product that I use, it's called Nitric Balance, which helps decrease the INOS and increase the epithelial nitric oxide. So we have, the clinicians that understand this know what to use and why to use them, okay? So having said that, this is the fire, okay? Now let's talk about the fuels to the fire. This is nothing. I could work on this, but if we don't get rid of the fuels to the fire, we're only band-aiding the problem. So in this clinic, we're big on cause versus effect. So we don't just want to band-aid it, we want to get rid of the gasoline, if you will, okay? So think of this as the fire, and over here, the gasoline. All right, so foods, okay, huge, huge factor. What we eat and how we break it down is going to depend on how this gut in the first third of the small intestine is able to absorb it and able to what they call assimilate it. So we already talked about foods that are able to, like glucose molecules, single chain amino acids, that get through the small intestine wall. And when they're in the bloodstream, they're able to get into the cell to be used for energy, basically, right? And what happens there is that absorption, and the proper absorption, because you don't want those other things getting through, is going to allow our cells to start working well without the inflammatory effect, okay? So the foods that I take in, the ones that you want to avoid this process from happening and adding fuel to the fire, are things like wheat, for sure, and most grains, okay? Wheat and most grains, dairy, soy, especially unfermented soy, processed sugar, and I call them the white devils, your flour, your sugar, your milk, and your salt. Those are the big three, especially processed. So when I talk to patients about eating, I want them to think about, if I'm on a deserted island, what could you eat? You could eat things that you could chase and kill and eat, or pick, right? Which is good vegetables, fruits if they're available, and good fats, if you will. But what the earth offers in its most simplest form. And I always say one ingredient foods as well. So if you can get one ingredient foods into your body, so which means you're eliminating your boxed food, your canned foods, you're eliminating the aisles in the grocery store in the middle, and you're staying around the perimeter, okay? Get foods into your body that are going to allow your stomach to be able to digest them better, okay? So second part of that is, what's in my stomach that's going to allow my foods to break down? Number one, digestive enzymes, okay? We need to take them because we tend to cook foods. When we cook foods, we denature the protein, okay? So digestive enzymes, and we have to make sure we have enough hydrochloric acid, okay? In the gut, or in the stomach, I should say, another area that could affect the stomach are infections, and one of the main ones is H. pylori. So I also have to make sure that we don't have infections in the stomach, and one of them is H. pylori, okay? When we get into the small intestine, we need to give the gut things that are going to help heal the leaky gut, okay? There's things like L-glutamine, aloe vera, marshmallow, licorice root, etc. So there's products that contain those that we could take to help heal the leaky gut. But remember, we can't have inflammation or infections going on, right? Because we'll just continually compromise the gut. So before I work on gut, I work on this, because you have to have that precursor step of lowering inflammation to allow the gut to heal, or else you're just going to be band-aiding a problem, right? So always think cause versus effect and how we need to work with that, okay? So we've gotten foods, better foods. We're healing the leaky gut. We're working on gut infections if they're there. So there's testing that can be done to rule out these infections, okay? Also, infections in the body. Do we have chronic viral infections? Do we have an acute bacterial infection? What's going on infectious-wise in the body that is driving this process here, okay? So we want to rule those out as much as we can as well. Toxins and something called xenobiotics, right? Or toxicants and xenobiotics. What these are, a xenobiotic are your synthetic chemicals, whether they're put on our body and absorbed through the skin, or we're taking them in on our foods. So if we're not eating organic fruits and vegetables, for example, we're getting pesticides, herbicides, fungicides, etc., that can get into our system and create a toxic overload, all right? Now, there's two parts to that. Number one, if I have a good gut, we have less chance of that happening. But the other thing, if my liver is working well, right? So we'll see patients that have heavy toxic exposure or overload, heavy metal overload, but yet when we look at them versus other people, we sometimes, because it's family, we could tell that their exposure is pretty much the same person to person in the family, but this one person has a high load of heavy metals or toxins, right? Is that because of exposure, or is it because their system isn't working as well as the other, right? Could be both, but I'm going to tell you my opinion. For most, it's this problem right here. The liver is not biotransforming properly. So we have to be very conscious of getting this liver, and it's called phase 1 and phase 2 detoxification. We have to make sure phase 1 and phase 2 detox is working well. So the exposure that we do have, which sometimes we can't avoid it. Now back up. We can avoid what we put into our body, right? But sometimes even what we put on our skin, in our hair, shampoos and soaps and things like that, they make a difference, okay? As well as what's going on in our environment. So some things are controlled, so we want to control the controllables, so we minimize our downside, and some aren't. But the ones that aren't, if we have good liver detox and good gut health, we're going to do a better job of being able to get rid of those toxins. We turn them into soluble form and we're able to get rid of them, okay? It's a big deal. So every one of my patients that I work with, they go through this, they go through gut health, and they go through a liver detox. And that's why. And it's super important because it's going to help knock this inflammatory or immune dysregulation down. Okay, I hope that makes some sense. A big deal. All right, as we move on, there are other things that occur in our body that create an increase in prostaglandins or an increase in these inflammatory cytokines. Blood sugar dysregulation. So if I'm a type 2 pre-diabetic or a diabetic, you can believe that insulin resistance is going to create a major increase in this process. I have patients that's all they have, and this immune system is going haywire because of it. So blood sugar and getting that regulated is significantly important. So we have a very specific protocol that we take people through to make sure we heal them, can get them that blood sugar regulated and actually heal the type 2 diabetes. Very, very doable, okay? Very doable. All right. Now, a lot of steps have to go on in order for that to happen, and the patient has to be very regimented in their approach, but we can guide them through the possibility to heal. So blood sugar is a big one. Hormone imbalance, big deal, okay? So here's an interesting stat. I'll throw this out there. Autoimmune conditions. 2/3 of all autoimmune conditions, women, okay? So I'm going to tell you, it's my belief that hormone imbalance is one of the biggest triggers to women getting autoimmune conditions, okay? Now, I'm going to give you an example because stress is a big deal as to that hormone imbalance. One of the main ways, and there are others, but just hang tight with this one, that a woman will get hormonal imbalanced is because the stress mechanism. So there's stress set up, and it affects something called adrenal glands. The adrenal glands produce cortisol, okay? So if I have chronic stress, initially, cortisol goes way up, okay? as time goes on and the stress is chronic enough, my body can't keep up producing that amount of cortisol, so we get low, and it's called adrenal fatigue. And I'll even, isolate this word. It's functional adrenal fatigue. It may not show up on a blood test, but I will tell you, if you're having these symptoms, if you're having issues with sleep, can't get or stay asleep, afternoon fatigue, waking up tired in the morning, anxiety, you're not having the ability to deal with stress like you used to, you're almost guaranteed to have some adrenal fatigue going on. So regardless of what a blood test shows, if I see that on a patient, I'm going to treat the patient, not the lab, if that makes sense. So we're going to give them support to help their stress and to help their adrenals. But I'm also going to find out why their adrenals have gone a little bit awry. Where are the stressors? Is it these stressors that we look at over here, or are they going through some emotional stressors? What can we do over here to help regulate the adrenals? So we can address the adrenals, but we have to get rid of the stress or minimize it if we can. All right, same thing, cause and effect. All right, this is the parlay into hormonal imbalances. When I have low cortisol, okay, cortisol is the body's most important hormone for stress regulation. So if you've ever heard of the term nervous breakdown or PTSD, I'll explain exactly what happens. My cortisol gets low. I'm not dealing with stress properly. Your body, as the sixth sense it has, is going to start converting pregnenolone and progesterone to cortisol. Okay? So we're going to get what they call a pregnenolone steal. And it's in all the literature, so you can look that one up. Stress, cortisol low, pregnenolone steal. But what that does to your progesterone levels, it starts to drop them. Okay? So you get low progesterone, and even if you have normal levels of estrogen, now you're set up for estrogen dominance. Okay? So what that's going to do, all right, that is going to create hormonal imbalances that will wind up this inflammatory response. So I see patients a lot with irregular periods, heavy periods, skipped periods, PMS, inflammatory conditions when they're going through the time, or even women that are postmenopausal that have this wind up constantly. What they're having is an imbalance most of the time. Now, they could also have low estrogens. We check for that. But I'm telling you, the main thing that we see is a low progesterone, estrogen dominant. It doesn't mean they're high on estrogen. It means they're not having enough progesterone to oppose it because they're stealing it to keep up with their cortisol. So if somebody hits the wall, I call it, where they have this nervous breakdown, I used to hear that growing up sometimes. What happened is they have this long chronic stress response, their cortisol is on the floor, and now they can't keep up with the conversion, so their hormones are on the floor. Now they don't have any chemistry to keep up with the stress response. It's a real chemical reaction that takes place that you just don't have enough fuel in the fuel tank, and you lose it. You have nothing left to fight, and that's what happens. So gas tanks on E is what happens. So again, we can support the hormones, okay? We can support the adrenals. The real key is what's going on that created the adrenal stress, that created the hormone imbalance, all right? So we can Band-Aid, but if we fix the causes, you won't need the Band-Aids anymore. That's what we try to do. That's the whole objective, instead of just giving you stuff, to give you stuff. I'd rather correct causes than just give you stuff to Band-Aid symptoms, because then you're spending a ton of money monthly on supplements. You don't know if they're working. You're not feeling that much better. There's no end in sight, right? That's not what we want to do. We want to fix causes so the outcomes are favorable, and you may not need a whole lot of supplements at the end, okay? Now, again, I got a little off track there, but the whole idea is, along with stress, which is chemical, physical, or emotional, it's also going to create this inflammatory windup. Now, this isn't the full list, but I ran out of room. So it just gives you the most common that we see, these fuels that are stimulating this immune system fire, okay? So again, to recap, we need to address the fire, but we have to get rid of the fuels. If we can do that, now what we're doing is setting your body up at the cellular level for an environment that's conducive to healing, okay? So if those cells can heal faster than they break down, you're in a good spot, okay? So don't let anybody ever tell you, well, it's age-related, right? I hear that all the time. Well, the doctor said it's age-related. Listen, here's the deal. These symptoms and these problems that we see are very common in our society, but they're not normal, okay? And I want to make sure you understand that really, really well. They're common, they are not normal, don't care what age, okay? The human body's designed to last a long, long time. The human brain is designed to last a long, long time with a high quality, high function, all right? But what happens in our society, because of these fuels, because of this inflammatory degenerative process that starts early, mainly because of the way our lifestyles are, to be honest with you, we start degenerating rapidly, okay? And it doesn't have to be that way if the right things are done. The point I'll make, there is a formula, okay? Over my career, I've worked with a lot of high-level athletes, okay? And the athletes understand that if they do all these different things, okay, their bodies are going to recover quicker, they're going to have optimal performance daily, and they're going to last longer with less degenerative effect on their body, okay? It's proven. There's a formula, okay? So the idea is if we do all that with our athletes, why wouldn't we do it for optimal function with everybody else, right? It's all about how your body's going to function and function at a high, high level, okay? So that gives you, hopefully, that's a lot of info, but it gives you, even if you don't understand every step, my objective is always to give you the big picture and go, that makes a lot of sense. There's got to be logic and common sense applied to this stuff, and that's what we're trying to do, okay? So I hope you learned something. If you need to go back and you need to rewind, this will be on Facebook, all right, or the website, the Center for New Medicine site. So you can go back and you can watch it many, many times if you need to. Or if you have questions or concerns, just call. I can help you any way you need to. Okay? I hope that helped, and I appreciate you watching. Everybody have a good day.
Thank you.
I didn't do anything. I didn't know what you